I had been losing my hair, I'd say, since I was a senior in high school. Throughout college, throughout medical school, it got thinner, and noticeably so. So I kind of suffered along with it and kind of played like it didn't bother me, and I felt that I was looking older and I wasn't all I could be. My parents were public school teachers, and throughout my life stressed education, and I kind of followed in their blueprint in that every endeavor I did in life, I tried to be the best at it. I had a lot of dreams growing up. Unfortunately, in high school, my mother passed from cancer. After that time, my lifelong dream was to be a cancer surgeon and somehow cure cancer, to make sure that no other young man or woman lost their mother at a young age. It started to recede, the corners started to go in. So I kind of suffered quietly for maybe 10 years or so. I'm in private practice, doing fairly well, watching TV, and I see an ad for hair restoration. I said, wow, that really looks good. So I had heard about Dr. Ziering, met with him. We kind of bonded immediately, and he knew exactly what to do, so I put my head in his hands and haven't looked back since. So I decided to change careers because I was just so excited and so impressed with the results from the hair transplant. And I was so pleased with the results that I wanted to do it as well. I believe in it 100%. Being a patient, being on the other side and seeing the results and see how it changed my life. I wanted to make sure that I would use my skills to give other people that opportunity. A good hair transplant surgeon, number one, has to be a scientist and an unending student of the craft. Also, that person has to have an artistic eye. Hair is very important. It's a frame for the face. So I'd bring science, pure, straight science, meeting artistry, and then meeting compassion, because I've been there, done that with the hair transplant, and I know what it feels like. I've had a hair transplant, because I believe in it. I don't think that anybody should go to a hair transplant surgeon who hasn't had a hair transplant. And it changes a lot as far as your self-esteem. I know personally what it's done for me to see a natural hairline that sometimes, if I did not know these people were my patients and I saw them on the street, I wouldn't be able to tell that they had a hair transplant. That's the best reward for me.